breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
All right, everyone, welcome back to this week's episode of Brainstorming with the Docs. I'm Dr. Kolby Condos, Dr. Glenn Harrison on the other side of the camera. Today we are going to be talking about a condition that affects 647,000 Americans each and every year and kills a person every 37 seconds and is responsible for 1 out of every 4 deaths in America. And that is going to be cardiovascular disease. It's something that affects lots and lots of people. It affects me personally. My grandfather suffered from heart attacks. I know that it affects Dr. Glenn. He has a familial history of it. So we're going to break down what are some of the signs and symptoms, what it is, and maybe some strategies that you can implement in your day-to-day life and that you can pass along to loved ones so that maybe if you have some people that you associate with or that you love that suffers from cardiovascular disease, that you can help push them or you can maintain your health so that you're there for your loved ones. So let's get started, man. Why don't you tell us what cardiovascular disease is? And
I think cardiovascular disease is just a generic term, trying to identify and explain as a disease process of the cardiovascular system. Could be heart, arteries, all vasculature, and it incorporates so many different things. So think of it as generic, I guess. I guess that'd be the easiest way of explaining it. There are different stages of like hypertension, and hypertension is just high blood pressure. So do you want to talk a little bit about high blood pressure and how it affects our cardiovascular system?
Sure. So I just wanted to point out that since we started talking, like 4 people have died from cardiovascular disease. So that's kind of crazy when you think about it that way. So hypertension is basically elevated blood pressure like you just discussed. And basically they grade it in 4 stages, and it all depends on basically the amount of pressure increase in systolic, which is the top number, and diastolic is the bottom number. So they go, I think, in increments of 10, and there's 4 stages. And why is high blood pressure so bad, right? Because all of us here, blood pressure is bad. High blood pressure is bad. Well, here's why. Because our arteries have smooth muscle in there, and we get what's called an elastic recoil when our heart beats, right? So as our heart beats, our arteries stretch and then they recoil and they contract, and that helps push the blood to the periphery and also to our brain. The problem with cardiovascular disease is that often it's not just elevated blood pressure that it affects, like you talked about, cardio, heart, vascular, the vasculature, arteries, and veins. When you have cardiovascular disease, you actually lose that elastic recoil, right? So the artery no longer stretches and it no longer rebounds. What happens because of that, it's like basically a garden hose or like water, right? The smaller the diameter, the more pressures that's going to go through there, right? So if you have a hose this big and you're trying to move water, it's going to go a lot easier than if you have a hose this big, right? Yeah. And the pressure goes up as a consequence of that. So when you have hypertension, it can be not only be an issue with the heart, but also the vasculature. It could be that you have stiffening arteries. That's
right. Also known as atherosclerosis.
Yep. It could be that you have plaques somewhere. There's a whole lot of different concomitants that can lead to elevated blood pressure. And that's why they start to take it really, really seriously. And that's why they put such an emphasis on those numbers where they say like 120 over 80 is normal. You know, you start getting to that 130 over 90, then it's going to start raising some red flags because they're going, why is this individual's blood pressure going up?
That's right. Yeah. And then when blood pressure goes up and up and up, and the concern of it, we're always worried about the pump. That's the heart. And the heart has a limited amount of beats. It really does. And that limit, the life expectancy of the heart drastically goes down when it's beating too hard, when it's working too hard. So we're always worried about the piping, if there's blockages, if there's a reduction in diameter and a loss of elasticity, putting back pressure on the pump all the time. The pump has to work harder and harder and harder, and then it has its last beat.
Well, and on top of that too, the heart the muscle can actually stretch, right? And it becomes thin because what happens is that the heart is no longer able to get the amount of blood in the ventricles out because the pressure in the arteries is higher. So the blood stays in the heart, so it has to push harder, and then that heart can actually stretch. I remember when I was in school, our cadaver actually died of congestive heart failure because he had elevated blood pressure and plaques in his arteries, and his heart, they say the average size of your heart's roughly the size of your fist. I'm not kidding. This guy's heart was that big.
I remember having one in that class as well, and it was remarkable. I mean, it was remarkable. So visual, anatomical changes with this, and there's so many things that creates that back pressure or creates that elevation. And then maybe another thing important is we're talking about hypertension, but causes of heart disease. You don't have to have high blood pressure to have a heart attack or heart failure. So that kind of takes us to what are some symptoms that people should be aware of. If they're listening to this and they have a family history like I do and you do, what would be some things that you would look for or you would pay attention to, signs and symptoms of potential cardiovascular disease?
Sure. I would look at like cold hands and feet. I would look at poor nail health. If your nails are brittle or they crack easily, if your hands and feet are always cold. A common one actually that's interesting that a lot of people don't normally associate with cardiovascular disease, if you're a male, would be erectile dysfunction. They actually developed Viagra initially as a blood pressure modulator, and they just found that it actually caused an erection as an unexpected consequence. Well, they ended up marketing it that way because, there's probably a larger market for it that way. You could look at that swelling in the feet, in the extremities. You can look at brain fog because your brain, as we've discussed in previous podcasts, your brain needs energy, oxygen, and activation to function. Well, your blood is what delivers all of that. And if you aren't able to, get blood into your head, then you're not going to be functioning at a really high level. So brain fog, you could get things like dizziness or a dizzy spell when you stand up, or any sort of like positional change. That would be another one. Can you think of any that I missed?
No, I think a big thing is that we always see is, pooling, blood pooling. And you mentioned that pooling in ankles and feet. There's many causes for it. Some of the strategies that we're seeing in the conventional model is, blood pressure medications that get you to lose all your water. So you always pee and you become dehydrated. And then they give you socks. They give you socks to get rid of the fluid. And no one's asking the why of the fluid buildup. So a lot of times it can be congestive heart failure where blood starts pooling. And it can be other things though. So I think those are some great symptoms to be aware of. Of course, there's the lab markers. I know we talked about, the cholesterol marker and all of those. Those are, I guess, a starting point. That's maybe the best way, a starting point. They're not indicative of a heart problem. So you talked about some physiological causes of heart disease or backing up the heart, plugging the arteries. What are some maybe other causes, more say like a loss of elasticity?
So what can cause loss of elasticity?
Mm-hmm.
Yeah. So, smoking, big one.
Yeah.
We see that a lot in those advertisements now. Smoking causes stiffening and loss of elasticity in the arteries. This is why people are more, at risk of heart attack and stroke when they smoke, because the arteries the vasculature becomes more frail. So in the event of like a high pressure surge, it's not able to like expand and then contract. It actually will just like rupture. You can see that type of thing. Another thing we've actually talked about in previous podcasts with like the diabetic and the diabetes podcast is like unregulated and uncontrolled blood sugar levels. Your vasculature is actually directly permeable to blood glucose, which means it can actually absorb it directly. And what happens when you have a dramatic amount of blood sugar is that it actually starts to do the same thing. The cells in your endothelial cells in your vasculature, in your arteries, absorb it, and then they become rigid and they become glycosylated, and it causes a bunch of damage that way. So we look at that. I know that you have a very interesting take on one of the causes. I'm going to let you talk about it because we've talked about this in previous podcasts, and you really preach this to all your patients, and me included.
Yeah. Sleep deprivation and high blood pressure go hand in hand. The research goes on and on and on. And back in the day, to pay for school, I was a shift worker. I worked in the mining industry, but at the time I didn't realize that they gave a premium for night shift, graveyard shift, is because it was so detrimental to your health. There was a reason why people, had higher risks of cardiovascular disease that were on night shift. And the statistics, it's staggering. It's actually what industry doesn't want people to know. And they collect it all, and everything lines up to being sleep deprivation. So sleep is a big thing. I had a case and in my office, and she had a blood pressure. So back to the textbook model of blood pressure is 120/80. That's what we see as textbook. Not that many people are there, but that's kind of middle of the road. And she had, it was over 200 over 140, something amazing. First thing I wanted to make sure she went to her medical doctor, and she just did, but the medications weren't doing anything for her. We started to look at her history, and she was sleeping anywhere from 3 to 5 hours a night. She said she couldn't sleep. It didn't matter what she did. Once sleep changed in a matter of a few months, she's a textbook blood pressure. Actually, it's a little bit below. So now she's going to have to go off her blood pressure medication. So
she went from 200 to 120 and 140 to 80.
Yeah.
Just from sleep hygiene habits.
Mm-hmm. So sleep is a big factor. There's a lot of research behind that, and it's hard to do sometimes. Sometimes I've had cases that we do everything under the sun and we're struggling with it, but it should be necessary. It should be necessary. Another thing is emotional stressors. Blood pressure is so funny. I love, well, actually I don't love, I love because it's funny. You get drug into a clinic. If you go for your checkup and go to the medical doctor, they have to do vitals right away. So you're quickly parked, try to figure out where you're going, and then running down the street. Of course, I'm exaggerating the story, but you're trying to get in time, and then you go in the waiting room, and nurse grabs you and hauls you to a room, throws you in a chair, puts a blood pressure cuff on you, tests it, writes down the number, and then you're out. Well, how accurate is your blood pressure going to be? It's never going to be accurate. Just that emotional disturbance is going to spike it.
Not to mention the 5 cups of coffee you drink on your way to the doctor's office.
That's right. Yeah, can't forget about that 5 cups of coffee. But that emotional disturbances will play into blood pressure all the time. So we got to realize that blood pressure responds and it fluctuates. And when I'm working with people and they're concerned about their blood pressure, we'll get them to do it twice a day, once earlier in the day, once later in the day, and not necessarily. And if anybody's listening to this that's on medication, their doctors only have that one number when they come in, and that's what they're judging their medication off. So, do your doctor a good service here. Take your blood pressure, follow the rules, and take your blood pressure twice a day, and do it in the same order that you do it from day 1 to day 2 to day 3. If you always do your blood pressure after breakfast, and that's going to be your morning regimen, always do it after breakfast. If you're going to do it before, always do it before. Not too worried about the times of day, just consistent from one day to another so you can measure. But that'll give your doctor excellent data. And I think it's very, very helpful. So one thing, because I know you're working with a lot of neuro cases, Dr. Kolby, I know when we talked about this before, you were talking about neurological conditions like anatomic issues.
Oh, sure. With your autonomic nervous system, you can have issues with blood pressure too. So it doesn't necessarily have to just be like cardiovascular disease that can cause alterations in blood pressure, right? It can also, like, there's a condition called dysautonomia where your autonomic nervous system is not regulating blood pressure very well. You can get dysautonomia after like traumatic brain injuries, whiplash, concussion, stuff like that. That's when you just have to be assessed for that type of thing. There's not really, there's not a lab test or anything like that you can use for it. But yeah, that is a potential cause of irregularities in blood pressure as well.
And it's, when the blood pressure becomes abnormal, it'll work directly on the brain. And I know we're talking about, heart attacks, and we think cardiovascular disease and high blood pressure, but there are some other things. You want to elaborate more on brain dysfunction due to high blood pressure?
Yeah, I mean, we talked about a little bit. If you have, if the diameter of your arteries and your arterioles and all the vasculature changes and it gets smaller, it's going to be harder to push your blood against gravity into your head. This is dumbing it down a little bit, obviously, but it's going to be harder to do it. Just from a pure mechanical standpoint, if the diameter is smaller, it takes more pressure to push it through. And especially when you're going against gravity, it's going to be more difficult to do it. And then you also consider that there's a bunch of small vasculature in your brain, and you're really not going to be able to get blood all the way to the end of the arteries and arterioles and capillaries and stuff like that. When you have blockages, or you have plugs, or you have, occlusions, which is like plugging and smaller diameter things. So then you look at neurological consequences like transient ischemic attacks, or you can get things like microinfarcts where they have a bunch of really small strokes all over the place. And it's just because they're not getting blood to that area anymore. You can look at, elevated blood pressure can affect the blood-brain barrier permeability. So then you look at, you have this barrier that wraps around your brain that's supposed to keep bad stuff out and the good stuff in, right? Well, if that thing becomes porous and it's letting things in and out that shouldn't be there, then you can have things like, brain fog, brain inflammation. You can have the possibility of infections, could be. There's a bunch of things that way.
Yeah, like the blood-brain barrier is like a blood filter, if you will, going to your brain. And if there's too much pressure, you can breach that filter, and you don't have that protective mechanism to stay away from pathogens and infections and even meningitis and things like that. Mm-hmm. So that's and then a big one that I'm actually doing a webinar on tomorrow. Not necessarily the time this podcast is released, but I'm going to be doing it tomorrow of cognitive decline and dementia. A lack of blood pressure or even too much creating levels of dementia.
Yeah, definitely can do it. Can cause cognitive decline.
Okay. So there's of course all the medications, the blood pressure medications and all of these things. But what are, people listening to this and they're concerned about heart disease? For example, myself, if I didn't, really know, but I had a family history of it. What would you point me in the direction? What would be kind of the first place you would create recommendations?
I think that diet and lifestyle is like the biggest thing first and foremost. We always preach that in pretty much all of our podcasts. But if you're smoking, stop, right? Mm-hmm. If you have poor lifestyle or poor dietary choices, if you're eating things that are just loaded in saturated fats and processed fats, we'll say, then I would avoid those. I'd move to more like whole fruits and vegetables, lean organic meats. Those are all some of the things we've talked about. And then exercise too. We actually talked a little bit in a previous podcast about exercise and how they are starting to use interval training for patients that have cardiovascular disease. So exploring some options as far as exercise might be a good option. And then just knowing your risk. If you are genetically prone to suffer from cardiovascular disease, then you're going to want to be hyper vigilant about it. Make sure you want to do your due diligence, get checked up regularly. You're going to want to implement these lifestyle and dietary choices really, really early, because the earlier, the better.
That's right. That's exactly right. I lost some family from this, and we caught my dad that had a significant heart risk, and just because of the genetics, their lifestyle was very good, but that wasn't enough. So we naturally had to dial in the lifestyle even more to try to compensate for the genetic layout of what he's doing, and including myself. So there is hope for this. I've worked with people, and maybe you have too, Dr. Kolby, where they come into the office and it's almost like they lost hope. It's like they're expecting to have a heart attack because all their family did, and there's no way out. Well, there's always a way out, and sometimes some of us have to walk a finer line than others, but very few people survive from a heart attack. They don't make it. So you can catch this stuff before it even happens. I know we did a podcast on cholesterol, how to reduce cholesterol naturally, and we get more into other heart efforts and cardiovascular efforts. So there'll be a link below for our topic on interval training, exercise, and as well as the cholesterol podcast where we get into that. So that'll be some strategies. But lifestyle, of course, is first and foremost. I always lean on sleep. I gave you that case, and everybody, I can almost predict how someone's sleeping. If they come in and they're complaining about blood pressure, I can pretty well guarantee that they're not sleeping the way they should. So there are some significantly powerful things, and you don't have to wait and just because, and this is something that I've learned, just because someone is 30, especially a male, doesn't mean their cardiovascular system is invincible. Heart attacks in mid 30s is a fairly common thing now in North America. 40s is more common as a male. So I think it's one of those things to remember that we're not invincible, especially at those ages. So,
and don't ignore it, right? You can't just put it in the back burner. If you know, like if you have a strong, familial history of it, like, oh, my granddad died, my dad's got it. Well, you can bet that I'm going to be a little bit more proactive than waiting until I'm 50, being diagnosed with it, and then trying to worry about it then. An ounce of proactive care is worth a pound of reactive care. So,
Yeah, I like that. That's true. It's very, very true. Yeah.
So if you guys have any questions or comments or anything like that, you can always get a hold of us. We have an email associated with the podcast and the telecast, and it's info@brainstormingwiththedocs.com. There will be a link in the description. You can get on Dr. Glenn's website. His website is www.drgharrison.com. You can get on my website. My website is www.northlakeschiropractic.com. If you have any other questions on some of the stuff we talked about, the links will be in the description. You can always go to the playlist, and we have a lot of stuff in there as well. And stay tuned, hit the notifications, because we're going to continue to come out with new material each week. And I hope you enjoyed it, because we'll see you real soon.
All right. Thanks, Dr. Kolby. We'll talk to you next day.
See you, buddy.